Hello, I'll be going through topic 11 of basic catheters and how they are used during UO or urine output measurement. So firstly, I would like to discuss what is a catheter. A catheter is a tube that is inserted into your bladder to allow urine to drain freely. Usually, catheters are used post-operative or after surgery when they want to let the bladder rest, or after surgery, or usually when there's after a urinary surgery or somewhere during the excretory system. So they'll use a catheter. How is it used for UO or urine output measurement? So it's important that to check the volume of urine after every surgery, because it can show if like maybe the patient is dehydrated, or maybe the concentration of fluids is not enough and all that. So by checking the UO measurement, we can just simply see, like, in the tube they'll give connected to the catheter from the organ, you can usually see the color of the urine. If the color of the urine is usually translucent or light yellow, it could say that the patient is sufficiently hydrated. But if the urine color is like bright yellow or like dark yellow, you can see that the patient is very dehydrated and needs fluids immediately. Another thing could be the volume of urine also. When you take the tube, usually it will be around 500 to 600 ml, and this would usually last a day or 24 hours. So when you see in a whole day after 24 hours, if the tube is like, let's say, only halfway, so about 250 to 300 ml, usually it will depend on the patient's weight, because the patient's weight is proportional to how much urine they are excreting. So let's say the patient is maybe 70 kg. If the patient is 70 kg, they should be excreting at least 140 or 150 ml of urine per every time they use the toilet. So if, let's say, for the whole day, 24 hours, the patient would at least have a few liters of urine, maybe 1.5 to 2 liters. It might sound like a lot, but depending on how many times the patient usually goes to the toilet and depending on the patient's weight, then it's not really that much. That's all.